S-TRAC was a phase 3 prospective multicenter study looking at the effectiveness of sunitinib versus placebo in patients at high risk for disease recurrence, particularly T3 kidney cancer or patients with node-positive kidney cancer. And in that prospective study, what we found was that treatment with sunitinib, up to a year of treatment, delayed disease-free recurrence by about 24%, with a hazard ratio of 0.76 and a p-value of 0.03. And this was a 615 patient study. We wanted to look at higher risk patients because patients at higher risk are more likely to relapse sooner, and because patients at higher risk may benefit by a greater proportion to adjuvant therapy. So we identified high-risk patients by either patients with a higher grade of disease, so T3 or higher grade 2 to 4, or a decreased performance status, meaning performance status of 1 or less. And in that group of patients, or node-positive T4 or node-positive patients, and in those subgroups of patients, we actually saw a greater overall clinical benefit associated with a year's worth of sunitinib, with a hazard ratio of 0.73, so you're actually a 27% reduction in the risk of disease recurrence. And that, again, like the overall population, was a sustained benefit out to 5 years or more. And it really suggests that, as we enrich for patients at greater and greater risk for disease recurrence, the benefit of sunitinib doesn't go away. If anything, it increases. And it, to me, it really reinforces in our highest risk patients, particularly those T4 node positive patients, we're seeing a benefit associated with this. And even though those numbers are decreased, the statistical significance was sustained, and that's really important.